NBC2 anchor Clay Miller found out why some women are turning to testosterone for help.
We've all heard the ads. Hey fellas, not feeling yourself, fatigued, not living up to it in the bedroom? Maybe it's low T. For years, testosterone replacement has been geared toward men. But Dr. Dollar of Gulfstream Urology says recently women are hopping on board.
We've been treating men with low testosterone, and then those men came home and the women saw them, wow, he feels great, he's energetic, he's a different person, his mood swings are gone. And they said, hey, I want also to feel great.
For 35-year-old KAILA Freeman, this could not be more true. Suffering from lack of energy, weight gain, low libido, she just accepted it.
I think a lot of women think that it's okay for them to feel that way because we do balance, home life, children, work, and trying to balance all those things. So we think, oh, well, how we feel is normal.
A normality that Mel Irvine of REVITALIZE says does not need to be. She says testosterone is essential in women just like men, but also declines over time.
Once we start getting up into perimenopause, now you have a woman who her body is no longer going to be making those hormones that she was making when she was younger. That's significant because women think it's a symptom. This is going to go away, I'll feel better, but it's not. You're actually living in a chronic state. This pushes
Testosterone has been proven to help with sex drive, mood, muscle strength, and overall well-being. It's given to patients in multiple ways: creams, gels, injections, and one of the more popular ones is pellets put under the skin to dissolve over time. Unlike men, the FDA has not approved it for women. Long-term safety is unclear. Regardless, its popularity is rising, and proper care is key.
Do it under a doctor, because this is something that if you're not doing it the correct way, it can have some drawbacks and it can be detrimental.
Absolutely. So testosterone is a controlled substance. You should never get it from your buddy at the gym, or you should get it from your friend. Beside the fact that it's illegal, it can be dangerous. You need to check your hormone. You need to have somebody monitoring them.
Once on it, the patient needs to continue for life. For KAILA, that doesn't seem to be a problem. Her patience paid off.
It takes some time to work, but man, when it started working, and I was like, wow, I can balance work and kids and home life, and I can do all these things because I feel normal again.
You can see the light bulbs going off, and then you can also see the frustration starting to set in because they've been trying to get answers for so long, and then once they get on these treatments, most women within 3 months are feeling significant differences.
Clay Miller for NBC2.
I feel like the storm's on some testosterone. Just